All right, diving in today, and this one's really fascinating, all thanks to you, the listener.
Oh, is this from that book someone sent in?
Exactly. Art therapy, research, and evidence-based practice. At first glance, art and
Ah.
research, they might seem like worlds apart, right?
Yeah, like totally different ways of thinking even.
And that's what makes this deep dive so intriguing. We're going to unpack how art therapy and evidence-based practice, that's EBP for short, how they actually come together.
As laid out in that book, right?
Right. Extracting those key insights. We're going to tackle the hesitations, the potential, the real-world ways this is happening. Think about it. Something as personal as art therapy, finding a foothold in research studies, clinical guidelines, even those service reviews.
So we're talking metaphors, research methods, those guidelines in action, and the whole audit side of things.
All of that. Get ready to think deeply, folks.
Okay, jumping right in, what hits you first in this book is the author's big push for art therapists to really get into research and EBP.
And not ditching their current skills.
Yeah. No, building on them. It's about adding to what they already do, that critical reflection, but with new skills.
Like what specifically?
Understanding those research methods, communicating findings in that research world, even grasping the bigger picture stuff that impacts healthcare. Policy, even.
Okay, but hold on, because anyone listening who's in art therapy, they might be thinking, wait, but art therapy is about the individual, their expression, all those different approaches.
Right.
And then EBP comes along, sometimes feeling like it's pushing for everyone to do things the same way, these pre-packaged approaches. Feels like a clash almost.
Definitely a core tension the book tackles. The author gets it, acknowledges EBP could lead to this, more uniform practice, these standardized things for each diagnosis, each setting.
But then there's the flip side.
Oh yeah, huge enthusiasm for that. If art therapists are strategic about EBP, understand the whole scene, it could seriously validate their work.
Evidence to back it up, make those benefits super clear, make it undeniable. Now, the book uses this striking metaphor, Bambi and Godzilla, to describe the anxieties around EBP. What's that all about?
Yeah, it's central to the book. Gambi here represents process-oriented psychotherapy research, those deeper dives, often qualitative, focused on the client's journey in therapy itself.
Okay, I'm seeing Bambi, gentle, vulnerable, even.
Right. And then Godzilla, that's your clinical and cost-effectiveness research. Does it work? Is it worth it? Often using quantitative methods.
So gentle Bambi versus this giant Godzilla mismatch much.
Totally highlights that worry, right? That subtle process-focused research getting dwarfed by this, Godzilla of outcome demands.
But there's got to be a bigger message here.
Oh, definitely. The book's saying this Bambi-Godzilla thing, it's a call to action. EDP's here. It's challenging us to see what's truly working, what's not.
But also that us versus them were.
Yeah. Process folks feeling like Bambi, effectiveness folks being Godzilla.
So how do we get past that, beyond just feeling threatened?
The book suggests understanding the stories behind both of them, their cultural baggage. It's not about picking sides. It's about realizing therapy itself, that relationship that can be the strength in building art therapy's evidence.
So not a battle, but a collaboration. That's way better. Now, what research methods are we actually talking about here?
Yeah.
Because it's not all just those big clinical trials, right?
You're right. It's a diverse bunch. Ethnography, looking at the cultural side, interviews for those deep dives into experiences, surveys for broader info, case studies for those rich individual stories, and experimental research, too. The book pulls examples from both British and American research, showing how it's all being used.
Okay, so a field that's already active in research. And you mentioned clusters of research starting to show art therapy's effectiveness.
Absolutely, emerging clusters showing it works with different client groups. It's optimistic, suggesting in some areas we've got the EBP-valued evidence. In others, there's enough initial research, the exploratory kind, to move towards those outcome studies everyone loves. And there are great descriptions of how it's done and the theories behind it, though more research is always needed, of course.
But then there's that best evidence debate, right? RCTs, those randomized controlled trials, often the gold standard, especially in medicine. Where does that leave other approaches?
Huge point. The EBP world, particularly the medical model, it puts RCTs up top. Then you've got your case series, expert opinions, a whole hierarchy deciding if something's empirically supported or just experimental.
So if art therapy doesn't always use RCTs, does it automatically lose out?
It can. The book acknowledges this. Some questions, especially in art therapy, aren't RCT-shaped. Plus, we might not have enough of that initial research in some areas to even do a good RCT. This hierarchy can undervalue other methods, even if they're super relevant and rigorous.
Sounds like EBP's got this strong medical influence.
Uh-huh.
How's that shape things, especially for a field like art therapy that's not purely medical?
EBP's structure, its values, very much shaped by medicine. But as it's moved into other areas, the book's saying, like any dominant thing, it'll evolve.
Because it's being challenged.
Yeah, social, political, cultural forces are questioning that traditional medical view. There's hope. Those big players like Cochrane Collaboration, SC, they'll become more inclusive as these broader good evidence demands come up.
For those unfamiliar, what does EBP actually involve? The steps, basically.
Sure. First, scrutinizing research for quality, relevance, then systematically reviewing it, often using that hierarchy we talked about. This graded evidence forms recommendations, clinical guidelines, finally audits, those practice checks against the guidelines.
So research guidelines, checking if they're followed, but the book mentions caution about these medical hierarchies in therapy, social care, education right now.
Definitely. While RCTs are often top dog in EBP, there's growing caution. Other valuable study types get ranked lower, and qualitative research often excluded entirely or at the bottom. Huge issue for art therapy, where qualitative stuff provides those deep insights.
Makes me wonder about funding. The book says service needs and cost effectiveness are often prioritized. How does that shape what research gets done?
It's a big influence. Research focused on immediate needs, proving cost effectiveness, that often gets the nod over curiosity-driven stuff. Government policies, funding bodies, they want knowledge for policy and to see if treatments work. This can pull focus away from understanding the whole context of mental health, pushing it towards just measuring treatment outcomes.
So not necessarily what practitioners or clients find important driving the questions.
That's a concern the book raises. Research agendas set by those with the money can limit what gets explored. It can create the situation where only research aligning with the dominant view gets done.
There's even the idea that the government's mental health focus might be more about public safety than individual care, that funding favoring the medical model could make researchers agents of social control. Makes you think.
It's a strong statement reflecting on potential downsides. The book emphasizes that research funding isn't equal, creating gaps. It also suggests that science itself isn't always purely objective, that it's a social thing influenced by various interests. This research market can favor certain types of research.
And that heavy reliance on RCTs within EVP can disadvantage fields like art therapy in this market.
Exactly. The book argues this emphasis reflects a value system favoring science and medicine, potentially disadvantaging professions using different methods to capture what they do.
This sounds like a very modern, absolute view of science.
Yeah.
But then the book brings in the postmodern perspective. What does that offer?
Postmodernism offers a key contrast. It challenges that unwavering belief in absolute scientific knowledge, questioning how it fits with EBP. It's not anti-science, but it's about recognizing limitations and that knowledge is always changing, regardless of the method.
Recognizing different kinds of valid evidence, not just one right way.
Exactly. Postmodernism says different evidence can coexist. We should consider diverse viewpoints from everyone involved, challenging that dominant medical narrative. This leads to a fundamental question. What is evidence in this context?
And the book mentions how evidence in psychiatry's focus has shifted over time.
Right, it outlines this historical shift. Early focus was on understanding mental illness itself. Later, the focus switched to whether treatments are effective. This coincided with advancements in statistics and the rise of RCTs, especially with computers making quantitative stuff easier.
So RCTs aren't the only way to think about what works in mental health.
That's key. The book argues EBP often leans towards a biological, behavioral understanding and RCTs as the ultimate truth. That fits a medical context, but not always fields like art therapy, which work differently. But the good news is, this dominant narrative is being challenged. Alternative ways of evaluating evidence are emerging, along with that postmodern idea of diverse perspectives and ever-evolving knowledge. Evidence-based doesn't equal RCT-based.
Let's revisit Bambi and Godzilla. The book hints at a resolution. What's the hopeful takeaway?
It reminds us Bambi grows, learns, becomes a leader. So process-focused research, it's tougher than we think. Godzilla also changes, becoming a protector. So effectiveness research, initially scary, could become a huge ally.
Art therapy getting stronger, collaborating with, not just fearing, those evidence demands.
Exactly. The book is positive about EBP's potential, but stresses it needs learning, adaptation, challenging assumptions on both sides.
It's interesting how the book highlights art therapy's inherent strengths as evidence itself. What stands out there?
Several key things. First, the art materials themselves, they can provoke noticeable reactions, data for the therapist. Second, the artwork's tangible, a record to review, discuss. Lastly, art making can sometimes bypass the conscious mind, revealing stuff talking alone might not.
The art is data. Unique to art therapy, right?
Hmm.
Now, shifting gears to clinical practice guidelines. What are they? Why important?
They're tools to pinpoint the best process for the best outcomes. Systematic, specific for both practitioners and those using services, often developed with input from different professions.
But could they get too strict? Take away from art therapy's individual focus?
Valid concern the book addresses. Guidelines aim to show normal practice, guide the right thing, but it's stressed they're about professional judgment, informing, not dictating. The book also says they're not for management to mandate or ban treatments.
A framework based on evidence and consensus, not a rule book.
Right. Good guidelines should be informed by experience, training, research. Build the evidence base, even encourage new ideas.
Are there different types of guidelines?
You've got assessment initial decision guidelines, and those focused on treatment choices during therapy. They can also help create audit criteria.
The book explains how these guidelines are developed for art therapy, right?
Multi-stage process. Starts with an expert panel of seasoned art therapists and other professionals. Comprehensive literature search, reviewed by reading groups for quality and relevance. This all contributes to a systematic overview. A development group then uses this, expert consensus, user input to draft recommendations. More consultation with panels, users, various professionals leads to revisions and the final guideline.
Service user involvement is crucial, isn't it?
Absolutely. The book stresses actively involving users at various stages, not just tokenism. Smaller groups, neutral facilitators, all help make sure their voices are genuinely heard.
What do expert panels do specifically?
They ensure all relevant research is considered, offer expert opinions, and review those draft recommendations. They're also confirming the clinical sense and practicality of the final product.
Collaborative and thorough. How do these guidelines actually get used?
Implementing them can be tricky. There's often resistance, skepticism about change. The book stresses anticipating this and showing the positive side through education. It should be local, sensitive, with everyone involved feeling ownership.
Another big EVP term, clinical audit. What is it and how's it different from research?
It's about monitoring and improving service quality. Some definitions emphasize resources and outcomes, but generally it's clinician-led, using peer review to check against standards. The aim is to align with the best evidence, research, guidelines, expert views, and user preferences.
The book mentions a potential downside, this audit culture, right?
There's a worry it can become overly critical, especially with economic pressures. This can create tension, discourage reflection. The language of empowerment and peer review can mask the accountability aspect. It could even undermine autonomy and trust.
So what audits are actually useful for art therapy?
Several types. Service audits, checking basic standards, service benchmarking, comparing accessibility and efficiency, routine outcome measurement, and cost-effectiveness audits. In art therapy, audits might look at client characteristics or clinical effectiveness, but it's vital to separate audit from research. Audit focuses on services, aims to improve and check practice, often using simpler methods driven by managers. Research seeks new knowledge, explores phenomena, uses more diverse methods, and is driven by researchers' questions.
There's a specific audit cycle.
Yep.
No.
Identify a problem, define good practice standards, gather data, analyze it, implement changes, and re-audit. For it to be truly useful, the purpose must be clear and the cycle relatively short.
What could art therapists focus on for audits?
The book suggests relevance to client needs, equity of access, accessibility, acceptability to clients, effectiveness, distinct from outcome research, and efficiency. Specific topics could be the physical space, equipment, referral processes, assessments. Prioritizing happens by considering potential problems, risks, and frequency.
It's about finding areas for improvement and systematically addressing them. The book also delves into the research methods debate. It's not just EBP or no EBP, is it?
Not at all. There's huge debate on what constitutes best evidence. Psychotherapists, psychologists, they all have different epistemological positions on research. Some love diverse methods, others prioritize outcome studies. Research itself is a broad term, specific, critical inquiry for new knowledge.
This takes us back to the meaning of science and empirical evidence.
Exactly. Science can mean knowing, a body of knowledge, or a system for gaining knowledge through specific methods, often focused on the physical world. seeking generalizable findings. Empirical usually means based on observation, experience, sometimes without strong theoretical links. The book contrasts qualitative and quantitative research, showing their different approaches to things like flexibility, subjectivity, data analysis, the researcher's role.
Setting the stage for revisiting those RCT arguments.
Yes. Arguments for RCTs include identifying harm, generalizing findings, documenting group changes, reducing bias through randomization, and showing cause and effect. The traditional EBP view often sees qualitative research as limited due to the complexities of practice. However, the book highlights its strengths, giving voice to users and practitioners, grounding research in real-world settings, allowing different ways to evaluate things. Qualitative research's validity relies on trustworthiness and credibility, not just statistics.
Different methods can be appropriate depending on the questions and values.
Absolutely. The book then outlines the research process: question, literature review, design, data collection, analysis, and sharing findings. It shows how methods influence the presentation and stresses transparency for replicability.
What about research ethics in art therapy?
It's about protecting participants, the researcher's role, data management, and what happens post-research. Regulations are increasing, with frameworks like the RGF and RECs. Key principles are independent review, informed consent, confidentiality, respect for difference, freedom of information, and participant involvement. Adjustments exist for social care research due to concerns about bias. When involving clients directly, extra care is needed with consent, accessible information, time commitment, training, support, costs, referencing ethical guidelines. The book notes a lack of client-centered research focusing on their perspectives and priorities.
Good to see the emphasis on ethical, respectful research. Now let's talk about visual methods and art-based approaches in art therapy research.
These offer exciting possibilities. Visual methods like video, film, photography are powerful. Art therapists have used video to observe sessions, analyze interactions, explore links between art and thinking. Some even gave clients cameras for self-representation and co-creating narratives. Image creation and discussion can be very valuable for data.
The book mentions an art-based approach specifically.
That's McNiff's idea. Using language reflecting art itself, valuing subjectivity and imagination, focusing on the visual and the practicalities of art making, aligning research with art therapy's core. Examples are heuristic research, exploring the therapist's own art, and arts-based autoethnography. Researchers are encouraged to visually explore their own responses to artwork. Collaborative visual and written documentation of art making is also promising. This type of research goes beyond looking at art in case studies to using art making as data analyzed within art and phenomenological frameworks.
Art therapists are familiar with case studies. What are their strengths and limitations as a research method?
Case studies, detailed descriptions of specific cases, are common in art therapy, growing from practice. They're often narrative, retrospective, or concurrent, and can mix data types. A major strength is centering the client's voice through collaboration. All materials are data. They need a clear focus and link problems, interventions, and outcomes, but offer rich insights. However, while internally valid, they lack external validity for generalization, though they contribute to the evidence base.
What about phenomenology and heuristics in art therapy research?
Qualitative research seeks deep understanding. Phenomenology observes and analyzes the essence of a phenomenon, requiring bracketing assumptions to understand from the experiencer's perspective. Challenging to describe and may not lead to cumulative knowledge due to its focus on individual essences. Heuristic research emphasizes personal connection to the topic, using introspection and experience. It's about the researcher's journey, contributing to theory and self-knowledge. Art therapists have used both to explore clients' experiences and develop theory.
What about interviews in art therapy research?
Research interviews are conversations with a specific purpose. They involve consent, recording, and researcher-set focus. They range from structured, fact-gathering to unstructured, exploratory. Rapport, empathy, and awareness of bias are crucial for the interviewer. Developing and piloting interview schedules, recording methods, establishing boundaries, and upholding ethical considerations are key.
The book also mentions collaborative and participatory action research. How do they fit in?
Collaborative inquiry involves co-researchers in all stages, offering user collaboration potential. Participatory action research also aims for inclusivity through training, support, power sharing, and mutual respect. These emphasize respect for users' experiences, empowering them as active participants.
What about single-case experimental designs for measuring outcomes more directly?
These N1 studies from behavioral psychology differ from qualitative case studies by controlling conditions and focusing on outcome measurement. The common ABA design involves baseline treatment baseline phases with repeated data collection and visual analysis for change. Variations and multi-phase designs exist.
Have controlled clinical trials and RCTs been used in art therapy research?
Yes, though less common than in other fields. Controlled trials compare art therapy to no art therapy but lack randomization. RCTs randomly assign participants to intervention or control groups, often with blinding. The book notes that even in these designs, qualitative and visual data can be included. Examples from British and American research focus on various client groups and often integrate qualitative insights.
How about surveys and statistics in art therapy research?
Surveys use questionnaires to gather qualitative and quantitative data. Careful wording, sequencing, and piloting are crucial. Statistics analyze relationships and data. Descriptive statistics summarize data, frequencies, averages, spread, often used in smaller studies. Inferential statistics test hypotheses and make inferences from samples, assessing the likelihood of chance, used in RCTs. P-values indicate the probability of a real treatment effect.
And when measuring change, we have variables and outcome measurements.
In experiments, we aim to establish causality. Independent variables are manipulated, for example, type of therapy, while dependent variables are measured for change, e.g., symptoms. A hypothesis might be that a certain duration of art therapy reduces depression.
The book discusses the consistency of research across different psychotherapies and where art therapy stands.
The variability in practice, outcomes, and research isn't unique to art therapy. It's also seen in other therapies. Reviews have highlighted this unevenness. Some, like CBT, have strong evidence bases, while others, including arts therapies, are often excluded or have weaker support by traditional EBP standards. This impacts service provision, but also shows the need for evaluation criteria relevant to each discipline.
The book then zooms in on British and American research with different adult client groups.
In addiction, various approaches exist, and art therapy is seen as unique and acceptable. With eating disorders, it helps with body reconnection and processing emotions, with attention to symbolic meaning. Research with adults with learning disabilities shows its potential for symbolic thinking, reducing challenging behaviors, and addressing trauma. For those with severe and enduring mental health difficulties, it can be non-threatening, facilitating relationships, expression, and potentially reducing symptoms and service use. Trauma research suggests even a single session can reduce avoidance symptoms.
What about research with children and adolescents facing challenges?
Research on children in chaotic environments emphasizes the art therapist's containing role and how materials can help process experiences, including self-harm. Literature on art therapy for sexually abused children points to its effectiveness, highlighting the need for safe, messy exploration and containment relevant for guidelines. Combining it with CBT and examining neurological links is also explored.
What's the overall conclusion about art therapy's evidence base?
The book suggests integrating psychosocial, educational, and behavioral approaches with art therapy seems effective. It encourages openness to innovation, researching both established and new practices using various methods. While acknowledging the lack of definitive proof and undervaluation, it emphasizes the need for ongoing outcome research, both quantitative and qualitative. Research showing not just that art therapy works, but also how and why is seen as most meaningful.
What a deep dive into art therapy in EBP thanks to your book. Now you, the listener, understand the complexities, the anxieties, the potential, the research methods, the guideline and audit processes, and the need for evidence. Here's a final thought. Given the challenges of researching art therapy and its strengths in nonverbal expression, what are the most promising ways forward for its growth in an evidence-informed world? How do we balance rigorous inquiry with the richness of the therapeutic process? Thanks for joining us on this deep dive.